It is Friday, April 24th. Wat Kahnawake Zuwagwego, Joe Delaronde Ujets. Welcome to our daily COVID-19 Task Force update. A busy program today. A little bit of news on a few different fronts. Joining us will be Lloyd Phillips, also Lisa Westaway, and Dr. Annick Gauthier will be back. But today we're going to start off with a first-time guest on the program from the Kahnawake Fire Brigade. It is Tanner Phillips joining us. Tanner is a paramedic and joins us this afternoon. Welcome to the program, Tanner.
Great, Joe.
Yeah. So tell us a little bit about yourself. First of all, I know you're a paramedic, but you do a little bit more than just being a paramedic.
Yeah, I do. So I'm a paramedic along with a medical instructor, and I also do quality assurance at the Kahnawake Fire Brigade. And basically, I'm just here. I want to speak to the community and just give them some updates on the everyday ambulance operation changes that we've been implementing, as well as the stressors that the paramedics have been under, and a couple of things that we're asking of the community, things that you can do to help us a little bit during the pandemic. So it's just important that the community understands that all of these changes that have been implemented are just to protect you and to protect us. So you'll notice when the crew arrives on scene for an ambulance call, it may take them an extra minute or two before they enter your residence. That's because they need some time to put on some personal protective equipment. Right now we're required to wear a mask, extra gloves, eye protection, and at times we're required a gown as well. So we just ask for some patience at that time. As the crew enters, we're going to do our initial assessment from a 2-meter distance, that's 6 feet. We'll ask some questions and we'll determine whether or not we need additional protective equipment. If we do, we may need to leave your residence, put on that equipment and re-enter so that we can perform any treatments and continue our assessment at that time. Also, it's a standard procedure right now. Should you be experiencing any respiratory symptoms such as cough, respiratory distress, shortness of breath, that we're going to issue you a surgical mask. We ask that you wear it as long as you can tolerate that. One thing I want to emphasize, and I know it's been mentioned before, but family members, friends are not allowed to accompany the patient to the hospital, or adult patients to the hospital. We know that this is an unfortunate reality. However, it's necessary, and I want to make sure that it's clear to everybody that that's not a reason to not call an ambulance and to not go to the hospital, especially if you are having a medical emergency. And finally, Anna LaBerge has created some significant modifications to the interior of their ER. So they have 2 separate entrances. One you're going to use if you have suspected COVID-19 symptoms, and the rest of the patients will be using a totally separate entrance to the ER. And that's just to really isolate those COVID-19 patients from potentially infecting other patients. Next, I just want to focus and bring light onto some of the realities behind the scenes at the Kahnawake Fire Brigade that our paramedics are facing and that they're encountering, I guess. So one of the most tedious jobs and tedious things that we've been dealing with right now is the constant protocol changes. A lot of our protocol changes have been given to us from Quebec, so therefore they're in French. We rapidly try to get those out translated and sent back out to our paramedics, also that we can provide the most up-to-date care for our people. We have our set of protocols that we've been drilling into our heads for a couple of years, and now we have to throw those out the window, learn a new one, and maybe next shift we come back in and we got to throw that out and start brand new. So that's definitely stressful, and rightfully so. Our ambulance crews work 24-hour shifts. Before the pandemic, the paramedics were allowed to leave the station during lunch, during dinner, go to the store, pick up some things, come and go, and that kind of helped break up the day. It helped some paramedics be able to be home with their families, have dinner, Now that's too great of risk for us to take right now. So our paramedics are in the station 24 hours a day. We can't leave unless there's an ambulance call. And that really does, make those days, those 24 hours, a pretty long 24 hours, longer than it already is. And that just adds to the stress, adds to the craziness of this whole situation, I guess. And last, our job places us in the front lines, in close proximity, close contact with these patients. And we knew when we signed up that this was a reality. However, we never expected to live through a pandemic, and it's definitely a stressor. And the biggest stressor I can think of is bringing that virus home to your family. We signed up for this. Our families may not have signed up for what we do. They didn't sign up for, contracting the virus, So it's definitely a stressor that we're constantly thinking. We have some measures put in place where we change our uniform, take showers after our shift before we go home, but it's still the risk is still present.
Well, these are stressful times. I know yesterday we had John D. Delormier from the Peacekeepers. They've had to make a lot of adjustments. Certainly the fire brigade and the paramedics have to do that. So I think on behalf of the whole community, we appreciate greatly the work that the frontline people are doing. Any final thoughts before you leave?
Yeah, I just wanted to end by thanking the community for their continued support. There's a couple of things that I'd like to ask of the community that would make our job a little bit easier. When requesting an ambulance, we ask that you call the PK station to request an ambulance and not to call the fire hall. So call the PK station 450-632-6505, request an ambulance instead of calling the fire hall directly, please.
All right. Sorry, go ahead.
Yeah. We also ask that you do not come to the fire hall if you need an ambulance. There's a couple reasons for that. One, we may not be there. We may be on another call, and that just kind of throws a wrench into the whole system. Should if you contact the dispatcher, the appropriate resources will be dispatched, properly, and you'll get your care faster rather than having to run around and deal with that. Second, right now, since the pandemic has been declared, no outside persons besides the crews that are on shift are allowed into the building. So if you do come to the fire hall, you will be denied access, even in the Bay Area where we store our ambulances and the fire trucks. And one last thing, we want the community to understand our limitations as paramedics. We're trained to treat emergencies, and when we receive calls for advice or wanting to be checked out, things like asking about the COVID-19 symptoms, it puts us in a very difficult situation because our scope of practice doesn't allow us to diagnose these types of conditions. That being said, we don't want to discourage you from calling for an ambulance. However, we just want you to recognize the fact that we're far from being doctors. And just before I go, I really want to take a moment to recognize the paramedics and the first responders for all their hard work. This pandemic has been crazy and stressful, and as first responders, we're not immune to stress. We're just kind of trained to really thrive under these types of conditions. And I believe that the work our crews have been doing shows exactly that. And I'm honored to work alongside each of them.
All right, well, thank you very much. Tanner, I know that we're actually getting a couple of calls. I don't know if you have time to answer one question, but what about CPR at this time because of the way things are with the pandemic? Are you still performing CPR? Are you still able to do that if there's a call?
Yeah, we've had multiple changes to the protocol and the sequence in which we are performing CPR, but we are still doing compressions and the typical chest compressions that you would see. However, there are some little changes. I won't go into detail, but yeah, we still are, definitely.
All right, well, thank you so much. Stay safe out there. Thank you for taking time to meet with us today, and hopefully we'll see you again somewhere down the line.
Yeah, Joe.
Okay, Tanner Phillips from the Kahnawake Fire Brigade, one of the paramedics, and joining us now is actually Tanner's dad. Tanner is following on in his father's footsteps as a paramedic, so we'd like to welcome our Commissioner of Public Safety, once again, Lloyd Phillips.
Thank you, Joe. Thank you, Tanner. It's great to see you here and giving some vital information and updates to the community. I guess this Friday afternoon, I have a couple of messages, a couple of updates for the community to consider. I guess my first message to the community is hang in there. I know it's been a long haul. I know people are getting anxious and anxiety is kicking in, and people are feeling the stress. And frontline workers, as Tanner just mentioned, are certainly feeling the pressure and feeling the stress. But again, I just had to say, hang in there, Kahnawake. We're definitely on the right track, and we are seeing the positive results. But as I said several times this week, now is not the time to let off the gas. We have to maintain what we're doing, and we have to be able to make sure we keep going until we know that we are certainly fully in the clear. And we're not there yet, but what we're doing now is starting the process of planning for that future. As we mentioned last week, we gave a directive to Instructor to start the process of a plan on how Kahnawake economics can be reopened. They call it Kahnawake economic revitalization plan. They put a plan together. It's in its draft phase at this point in time. There's going to be much more work to happen over the next week, but they did provide an update this morning, and it's a very comprehensive report. It's a very comprehensive plan, and I'm very satisfied with what I've seen and on the way to move forward. When we're at that point in time to turn the key into the next phase where we're reopening the economy, I'm confident that the plan that's being put together is going to be something that's going to be comprehensive, and it'll be fair to ensure that priority businesses are opening up in a way that makes sense and is fair as can be across the board. There also include measures to ensure that there is proper infection control procedures in place immediately and for the foreseeable future, as well as any policies and procedures in which should be adopted across the board for all businesses, and to also to ensure first and foremost the safety of the employees and your customers and their customers, I should say. So that's some of the plans that are being put in place and developed. What we're going to be doing is also working on some education pieces so that our inspectors and such can go out into the business community to assist them in setting up whatever proper safety mechanisms and measures that will be required. So we're planning for the future. That's why I say there's that light at the end of the tunnel. And so when we're ready to turn that key, we have a plan in place. The business community is ready to get on board. The business community knows what to do, and then we can get things back on track as fast, but as safely as we possibly can. And keeping in mind, these safety procedures that are currently being put into place and that will be in place once the economy starts going again will remain in place for some time. Because I'm sure some of you have heard already on the various news media outlets about the possibility of a second wave of a pandemic coming in the fall or the winter time. No, I don't want to get ahead of ourselves. No, let's get over this first wave, but No, if we're looking, no, and planning for the future, if we plan solid now and we plan how business will operate from here until the fall time, the economic impact, and maybe we won't have to take as strong measures as we took this time, if there is that second wave. We'll be prepared, we'll be able to mitigate the issues, and hopefully have minimal impact on the economy of our community. So we're looking at the big picture, at the long term, on where this will take our community. Keeping in mind, there is that possibility. Like I said, I don't want to put fear into people, but it is a reality that we have to continue to look towards. As well as along the same lines, we had given a directive today to all the community organizations for them to develop a similar plan on how they're going to move from currently is essential services only, and how that's going to evolve back into the state of whatever is going to be the new normal. So again, in a phased, systematic process on how they could get back to normal operation, again, quickly, but again, as safely as possible. So for the same type of directive for the economics and the business community is the same, very similar what we put forward for the community organizations to implement and get the plan ready. And implementation will be at the discretion of the task force, based upon the medical advice, based upon the science that we see out there, and mainly from Dr. Gauthier, who will be up here in just a few minutes' time. So that's some of the work that's happening. And as well as you may have seen that Quebec, they also mentioned next week they will be putting out their plan to get the economy going. We have no idea at this point what that plan will look like, but I want to reassure the community first and foremost that we're creating a Kahnawake plan, and secondly, the plan that Quebec is making is a Quebec plan. And I'll reinforce the fact again that decisions made for our community are going to be made by the Kahnawake COVID task force, and that's something that we said throughout. And I just want to repeat that again, because I know when we're talking about economics, we're talking about opening up, we're talking about maybe relaxing some of the measures. People really want to move in that direction quickly, but again, we have to make sure that we're doing it on the best interest of our community, because Kahnawake is much different than Chateauguay and much different than Montreal. We are a very unique community. Again, like I said this morning on K103, if you're listening, being a close-knit community, knowing everybody, having our friends and family here is a great thing. It makes us strong, it makes us powerful, but it also makes us vulnerable at the same time. So we have to keep that in consideration in whatever plans we are moving forward. We see, again, the light at the end of the tunnel, and as a task force, and I can tell you in my role leading the task force and as a public safety commissioner, as I see the possibility of things happening down the road, it also brings a level of anxiety, because if we're doing a great job right now, and I certainly don't want to see anything that's going to throw us off the rails, to take this, what's the positive things that have been happening, how we've been moving, how we're having no serious illness, 0 deaths. I don't want to see something that's going to happen that's going to throw us off the rails, and then we'll be talking a whole different story in the weeks to come. So again, the message again is stay the course. We are doing a great job, and we owe it to ourselves to do what we are doing, because we had too much sacrifice and too much hard work done for us to do something now that would change the course and the trajectory on where we are going. Because keep in mind, the past week or so, still 100 people a day are dying, in the province of Quebec. And if you look down south to our neighbors, which we are all very close to the U.S., over 50,000 people to date have died because of COVID-19. So we can't forget those numbers. We have to keep them in the back of our mind, because we're not out of this yet, but we see the light, and we're going to keep moving that way. And with everybody's cooperation, we'll get there sooner rather than later. With that, I also noticed that the weather forecast, even though it clouded over a little bit right now, it's supposed to be fairly nice for tomorrow. I certainly encourage people, get outside, enjoy the weather, enjoy the sunshine. Exercise, get some fresh air. It's good for the mind, good for the soul to get outside. But again, physical distancing, make sure that you keep that distance between you and the person next to you. Mind you, if you are a family unit out together, by all means, you could enjoy your company, and that's something that we certainly encourage people to do, because I know how it feels. I went a couple weeks ago to go fishing and managed to get outside, and when you're outside and doing different things, you have that sense of normalcy, and I think that's something good for everybody could use about now. So once again, Kahnawake, we have a few more speakers coming up, but once again, I'd like to just say, stay the course. We are on track. I'm very proud of where we are today, but let's not do anything that will change the course and the trajectory in which we are on. No, we owe it to ourselves, and like I said, we owe it to our elders. Nyamagawa.
Thank you very much, Lloyd. All right, so we have a couple of people coming up now from the Kahnawake Memorial Hospital Center. Dr. Annick Gauthier will be here shortly. But before that, we have a little bit of information coming up from one of our regulars, Lisa Westaway, the Executive Director of the Kahnawake Memorial Hospital Center.
Good afternoon. Thank you. We have a couple of new directives regarding long-term care that I would like to share with you, as they may have an impact on your loved ones, and I think it's important that you have this information. So today we received a new directive from the ministry that any long-term care patients that are transferred to a hospital center for more than 24 hours will not be able to return back to the long-term care facility. We expect to get a little bit more information about this weekend. This is a change from how we were functioning just a couple of days ago, and in fact last week we did transfer to Anna LaBerge and we did transfer back to long-term care. When we were transferring back to long-term care, firstly we had to have a negative COVID test, and then when they came back to KMHC, they would be under contact precautions, meaning they would be self-isolated in their room for 14 days. So we had very strict precautions in place to ensure that if somebody would come back from the hospital, that we would limit the possibility of transmitting the virus, and our staff were also very well trained in using the appropriate PPE in these instances. However, as of today, and this is based on data that they're seeing from retransfers from hospitals into long-term care facilities and the impacts on the long-term care facilities, the ministry has put a stop to those transfers back. So I think it's important that you be aware of this. We do everything we can at KMHC to not transfer to the hospital center, but in some instances there are medical conditions that require that transfer. If an individual is at the hospital center for less than 24 hours, they can come back. So that's a little slight difference. If it's less than 24 hours, they can come back, but anything over 24 hours at this point, as of today, they will have to remain at the hospital center. So you may be asking the question for the Elders Lodge or for home care. So the directives are not the same for those two places. So if you have a loved one that does go into a hospital center who is a resident of the Elders Lodge or who is living at home, they will be able to go back to their place of residence. However, there are certain precautions that should be taken. So at the Elders Lodge, as I mentioned, we were doing for KMHC, the person who returns to the Elders Lodge will be put under contact precautions. Therefore, they'll be self-isolated for 14 days, and any staff that work with them will be using appropriate protective equipment. And if somebody is transferred back to their home, then we ask that they also be self-isolated for 14 days. And so that's something that is not necessarily in the clearly documented in the directives, but we feel that it's safe practice especially for our elderly or for our loved ones, that they stay self-isolated for 14 days, and that you check in on them also on a regular basis, just to follow up whether they're developing any symptoms. I'm going to change subjects. I wanted to talk a little bit about the testing site. So our wonderful PR unit over the last couple of weeks did a survey in the community, and I think they'll probably give you a bit more details about that survey in the next week. However, I just wanted to pull out one of the questions that was asked on that survey regarding whether you were developing symptoms. So there was a question, I didn't write down the exact question, but if you developed any symptoms and if you were tested. And so I wanted to give the results of that question in particular. So there were 343 respondents, and so there were 4 categories of possible answers to that question. Yes, I have developed symptoms and I have been tested. Or, yes, I have developed symptoms, but I have not been tested. There was also the possible answer of I have had mild symptoms that I don't believe were COVID-19. And then a final answer, no, I have not developed symptoms. So the largest category, no, I have not developed symptoms, was at 79.01%. So out of the 343 respondents, the greater number, almost 80% of the people who responded stated that they did not develop symptoms. There were 44 people, so almost 13%, that stated that they did develop symptoms, mild symptoms, but they did not believe it was COVID-19. And the other 7%, yes, and I have been tested, and not even 1% stated that they have developed symptoms but have not been tested. So I guess I want to bring your attention to those 44 people who have developed symptoms but have not been tested, and who have made the self, I guess, assessment that this was not COVID-19. So I would urge you to, I would urge people to contact the testing site for possible testing in the event that they do develop symptoms. And so this brings me to my next point, which is also some new directives that came out today, which specified a little bit in more detail the criteria for testing. And they've clarified a little bit some of the possible symptoms. And so I think it's important in looking at those 44 people in helping you kind of self-assess. So Group A are all the symptoms that we're used to hearing about: fever, cough, or respiratory difficulties, or loss of taste or smell without any nasal congestion. That is Group A. If you have one of any of those symptoms, you should be calling for testing. And if you're not calling for testing, you should still be self-isolating for 14 days. Group B, we're asking for you to look for 2 possible symptoms of the following symptoms. So muscular or any muscle pain, any intense fatigue, loss of appetite, sore throat, gastro symptoms, or headache. So if you have any 2 of those symptoms, you should be self-isolating for 14 days, and you should be calling the testing site for testing. So that gives a little bit more detail, and it clarifies a little bit more from what we've had in the past. Again, as I mentioned, we're working out the details to be able to come to you for testing. That's going to take a little bit of time to organize. We will be calling each individual household to do phone assessments, health assessments, and help you, work through some of this algorithm about whether you should be tested or not with you. And we're going to try to facilitate getting closer to you for testing so that you don't necessarily have to come to us. But we're still open, and we urge you to call. We open again for testing on Monday, and we really urge you to call. And by Monday, we'll be having a bit more clarification on the process that we're going to implement to be able to come closer to you for testing. So with that, I'm very happy to present Dr. Gauthier. She's going to answer many of your medical questions, and I'm very happy to have her here with us again. She's my new BFF lately. Thanks.
Yeah, Lisa. Hello, everyone in Facebook land. So I didn't actually have that many questions today. I only had 2 questions. The rest, there are questions that I have that I think are good questions, that I think maybe many of you have them at home and just didn't think to write to me. Or maybe it's because you're all taking my advice and you're all going on to Quebec.ca, going on to reliable resources and reading about everything and getting the answers, and you don't need me anymore. That's okay too. But as I'm here and I prepared a little bit, and you can just turn off your Facebook if you don't want to listen to me anymore. Masks. I got another question about masks. So I really want to wear a mask because I don't want to have to social distance. And that's right? And then some of the masks are made out of really cool things like velvet and beads. Should I wear them? And so the answer is no and no. So wearing a mask doesn't mean you stop social distancing. So I sort of feel like with this question about masks, it's like a child like coming to you and then coming to mom and dad and then other people to ask if they can have a candy bar. My answer, unless data changes dramatically, is going to be no. Masks are not what's going to actually prevent COVID-19 transmission. It really is about social distancing and hand hygiene. So even if the Kahnawake Task Force, Quebec government, Canadian government go forward with gradual, incremental opening up of the population, opening up of businesses, it's still going to be about hand hygiene. This will be your new BFF. Sorry, Lisa. And social distancing. Those are what you're going to still need. So I don't personally recommend face masks to anyone, especially cloth face masks, because it hasn't been shown to help prevent transmission. And while I haven't seen any data where actual harms from wearing a cloth face masks have been published, there is clear data in the healthcare workers' data that if you wear a face mask as a healthcare worker, you actually touch your face more, and that could actually decrease your hand hygiene. And when you decrease hand hygiene, that's where you have infection. So the most prevention remains: wash your hands, avoid touching your face, and social distancing. If you cannot maintain your social distancing, so if in a couple weeks, whenever things open up and you have to take the metro, that would be a case where you could wear a cloth mask, or ideally you could actually just even wrap a scarf around your neck, be like Audrey Hepburn-like. I don't know if that's, if you're younger, you might not get that reference, but just Google Audrey Hepburn, you'll see what I mean. But the best line of defense, again, is hand hygiene and social distancing. And if you wear a mask or any kind of facial covering, wear the cloth ones, leave the procedure masks and the N95s for the healthcare professionals. If you're wearing the mask, the cloth covering, it's to protect others, not protect yourself. And I think that's what people understand. I know that there's like lovely memes of Prime Minister Trudeau about speaking moistly, and I know it's a word that bothers people a lot, including my sister-in-law, but I'm gonna shout out there. Okay, next question. When are people contagious? So I've discussed this a little bit before. Some other papers have come out. I've talked last time about a paper in Japan, and then there's another paper in China where they do infector and infectee pairs. So they follow, because they were really quick on contact tracing and then immediately like isolating the people, and I used my hands because it was like often done forcefully and physically, they were able to then follow both these pairs of people, of the person who was infected by the other person, and follow their viral load over time. And it really sees that the viral load peaks just as you develop symptoms and then peters off. So 44% of secondary cases, so 45% of the people getting infected after the first person got infected, it occurred just before the symptoms occurred. So just as they got symptoms, that's when they were the most infectious. So other studies show that it's really from that 48 hours before going to 4 days after you have symptoms, that's when you're the most infectious. Now I'm going to talk a little bit about asymptomatic and people who have very little symptoms. Yes, they can potentially be infectious, but it's really not that much. It's like 6% of infections are caused by asymptomatic people. The more symptoms you have in that beginning buildup of the symptoms, that's the people that are most contagious. So the contagious period really is that 48 hour before to the 4 to 5 days after, and that's when you're most contagious. Now, There are going to be people that are going to be contagious longer, and that's often the people that are very, very ill in the hospital. Now, the next question goes, when do people stop being contagious? I have heard stories of people shedding virus for 40 days. What is shedding, and is that true? So shedding virus just means that they're detecting virus, or in this case, actually viral RNA, in the nose. I've talked about in the first Facebook Live about detecting in the poop too, but today we're talking about nose. So yes, you can detect it in the nose. Now remember, we're not detecting live virus or virus that can replicate, we're detecting RNA. So a couple of papers have done this. They looked, and you can, basically most people can stop shedding about 21 days after they start symptoms. Others have said RNA can be detected up to 17 days, but it's in that ballpark. But there are other people, it's true, can shed for a lot longer. However, those people aren't infectious anymore, and the reason for that is they've actually developed antibodies. And I'm going to discuss that a little bit more in a second. So unless you're very ill or immunocompromised and therefore don't develop an antibody response, most people will have antibodies formed within 2 weeks and they won't be contagious. I'm going to get back to antibodies in a second. So the next question is, can you be reinfected with COVID-19? So it's not black and white, but basically you should be immune for a few months. The question is how long that immunity will last. We don't know yet. There hasn't been enough time, but if you look at other coronaviruses, you're most often immune for a certain amount of time. Just like if you think back to the childhood vaccines, you know how they come in multiple times. I don't know if you've asked which vaccines they're getting, but they often get the primary series, so they get a first vaccine, and then they get booster shots at 4 months, and a year and so on. That's because your body needs to recognize that that's bad and that needs to make an antibody response against, but then you need your antibodies to be cooked into full gear and make really good antibodies. So that's where people are looking at how long this immune response will last. I have read about in Germany, there's a test to prove that you were immune. What is that? What does immunity mean? Okay, so now I'm going to do a little bit of immunology. So antibodies are produced by our body in stages. So there's IgMs that are first produced, and that's during an acute infection, so the beginning stages of infection, and you'll see those within usually about a week. But they're not very good antibodies. Like, they're just sort of like, help, help, help me antibodies, not like, I'm going to kill. Like, it's sort of, I can't even think of, I don't have a Facebook-friendly analogy that I can give you at the moment. Now, you have the IgMs initially, but the good, strong, like bouncer-like antibodies are the IgGs, and that's when you have a resolved infection. So to be immune, you need IgG antibodies, antibodies that recognize and actually neutralize and kill the virus. So there are papers looking at antibody response. There was a paper that was published recently in California of 3,000 people. They had 2.8% had antibodies. But they were looking at both IgM and IgG. They didn't separate that out. So all you know is they have antibodies. You don't know how good the antibodies are. Often, and this is what's happening in Germany, and I know there are actual antibody tests that are produced in Canada and now being sent to the US and other countries, but in Canada we're only using it as a research trial, not as actual to look and see if someone's immune, is there are fast antibody tests that you just take blood sera and you put it on this test and you can actually develop and see if there's antibodies. However, very recently the FDA has come out, and the reason why public health did not actually agree with this in the first place is that these are not specific enough, and the data is uncertain, and they don't want to be able to make a decision on someone's immune status based on that data because it's not trustworthy enough yet. So definitely there are studies going on. I know that if you have had COVID, I know that Canada Blood Services is doing a big research trial on that, so please Google that and look that up because you could be potentially saving someone's life in the future if we can understand how the immune response works. There is an interesting study that was done, but again, it's with 5 patients where they took convalescent sera. So that's people that have had COVID-19. They took their blood, they purified it, took everything out that's garbage that they don't want, and then they actually found antibodies against COVID-19 or against SARS-CoV-2 that are high binding as well as high neutralizing, and then they put them back in 5 patients that were very, very sick. Now, they didn't do a control trial. This was just as a humanitarian last-ditch effort, and they actually, all those 5 patients did improve and did do better. However, it's a huge thing to take, like that's like, oh, well, I'll just purify some antibodies. I don't know if anybody at home has done this, but it's not so easy. I have done this. My team that I worked with before has done this, but it's not a simple, easy feat. So I don't think that's going to be our way forward. The next point, I sort of have 2 different things, is that what is the reopening strategy? And with that, I've heard Dr. Arruda and Legault talk about herd immunity and natural immunity, and what does that mean? So I'll first discuss what those terms mean. So natural immunity is immunity acquired after being infected with an infectious disease. So if you were infected, now, okay, one of the other viruses I've worked on in my past is rhinovirus, so the cause of the common cold. And there are like 300 different types of strains of rhinovirus. But when you're infected with one strain, so one of my favorites was HRV16. So if you're infected with HRV16, you can't be infected again with HRV16 because you're going to get antibodies to that. So you are naturally immune to HRV16. It's unfortunate there's another like 300 or 400 other viruses of rhinovirus, but at least for HRV16, you're okay. Now, herd immunity is a form of indirect protection from infectious disease that occurs when a large percentage of the population is immune to an infection. So either they have gotten immunity through a vaccine or they've gotten immunity through previous infections. Now, they are the herd that's protecting the people that don't have an antibody response or haven't seen that virus or bacteria before. Now, ideally, when we talk about vaccines, we want a herd immunity above 90%. Now, for COVID-19, because we don't have a vaccine yet, the goal is 60–80% would actually be able to sort of control basically future outbreaks. But right now in Quebec, and this isn't based on the serology, this is just based on the fact that we know less than 5 to 10% of people in Quebec have been infected, and therefore probably only 5 to 10% of people are immune to COVID-19 at the moment. So that's a huge amount, between 5 to 10% to 60 to 80%. Now, there's a paper out of New Zealand that's recent that looks at the R0, and I've mentioned this before. So R0 and R effective are for every one person who gets the virus, how many other people can get the virus. And we've talked about it that initially we thought it was like 3, but now it's sort of more gearing towards like 5 or 6. Well, these people did actually studies of across the United States, across New Zealand, across Quebec, and then they looked at different ways of basically limiting spread. All the things we're doing, social distancing, closing down businesses, and so on. And what they found was they actually looked at the Quebec data, and they have our effective is 5.37, so it's quite high in Quebec. It's actually it's the highest in this paper, in this study of looking at many states in the United States, including New York State. We have a very high number of people are affected from that one infection. Now, with the measures that have been put in place, it's gone down to 1.1. And you're like, oh, that's great. We can open everything up. Swimming tomorrow. No. 1.1 is still too high, and it still actually will not contain the virus. All epidemiological work shows that you need to have under 1 to be able to basically control and prevent future outbreaks and future waves. And right now, I know we're in the first wave, and we're still not. So because of that 1.1, I know that we're not over the hump. When you look at the number of deaths per day, you look at the number of hospitalizations, the number of cases, as I've mentioned before, is very hard to go by because not everyone's being tested, as Lisa just mentioned. And that's just for our community. It's even less are being tested outside because of a lack of access to these reagents. So that brings me to a point, and I'm gonna steal, I asked permission though, from a colleague and friend, Dr. Chris Karatsios, pediatric infectious disease specialist at the Montreal Children's. And so he, just before I actually came up, he had posted an open letter to Dr. Arruda and to François Legault. And there's some points in it that I think are really important, especially when we talk about reopening and especially when we talk about kids going back to school. So I want to talk about kids for a second before I bring up Dr. Karatsios' points. So kids, The idea is that we bring them back to school, and that's where they're throwing out herd immunity, and this is going to be great, and they're going to develop the immunity among the children, and that's going to spread to the adults. But there's no evidence to actually make those statements. And I know that the Quebec Association of Pediatricians came out and said that they're in favor of children gradually going back to school. But read the letter. The letter doesn't talk about immunity. The letter doesn't talk about preventing outbreaks in the population. The letter is about the social and physical and mental well-being of our children. So that's what it's about. The herd immunity in an adult population needs to be developed in the adults, not in the children. And the reason for this is when you look at populations like Sweden and South Korea that didn't actually close down their schools, they had that didn't change how the immunity was developed in the population. And the reason for that likely is that most children have a very mild and even asymptomatic infection. And if we know that if you have a very mild or you're asymptomatic, you don't actually produce much virus, and you probably don't even develop that much of an immunity. And if you're not producing virus, you're not spreading it to other people. So the idea is that if you think that you're sending back the kids to school, it's because you think that the kids are the vectors. The data does not support that. Maybe things will change, but that's the issue. There's other reasons for why you would want to send children back to school, but that's not because of herd immunity. The herd immunity is going to come from adult population. So this is where I'm going to go to Dr. Curatio's point. So do we really think we should be opening up Quebec when we haven't peaked yet? He says no. I say no too. There's a couple of steps that we need in place before. We need to get to the peak. We actually need to go beyond the downward cycle. We need to have less hospitalizations and less deaths successfully day after day after day. And we'll know then we'll have more people that have recovered from COVID, and therefore that 5 to 10% will gradually increase. There's some actual scientific things that need to be done. We don't have a large-scale antibody testing program. We need to develop that. We are close to running out of materials for testing for the virus and the nasal swabs. We need to build more of that. We need to have a way of quarantining and tracking every new case. There are apps that track movement that they've been using in South Korea. I know there are places in Canada where they've developed some of those apps. We need to do that here. The other thing is that if we start opening up, we have as a society to be able to understand that among adults to develop herd immunity, people will die when we do that. And that's a huge, huge social experiment that I'm at the moment not willing to take. If you look at Sweden, they did not close the way we did. Their death rate was crazy high. A lot of people died. They are developing immunity, and things are actually looking pretty good that their immunity was developed within a few weeks. However, a significant portion of the population died. In the United Kingdom, they tried doing the same thing, and you can see actually their prime minister ended up being in the ICU that same day, and they actually closed down this possibility of opening up too early. So it's really important of understanding that yes, we need to open up early, and being able to not open up early. We need to start gradually opening things, but we need to understand why we're doing it and have the tools in place for when that happens, that we are able to control the situation. All right. Next, second to last question. With the warmer weather approaching and people wanting to go outside, is there anything to worry about as far as mosquitoes are concerned, or black flies for that matter? Can they carry the virus after they bite someone who unknowingly has bit another person? So SARS-CoV-2 or COVID-19 is not a bloodborne virus. So the answer is no. I don't worry about mosquitoes or ticks. So there are viruses and bacteria and parasites that are spread by mosquitoes and ticks. So example, mosquitoes, you have West Nile virus, you have chikungunya virus. I've always wanted to say it on television or this thing. So chikungunya virus, dengue, yellow fever, Japanese encephalitis, or malaria. Ticks, we have things that you know about, Lyme disease, so that's called Borrelia, the tick-borne encephalitis. There's a variety of things. But COVID-19 is not spread by blood. COVID-19 is spread by respiratory secretions. So I wouldn't worry about the mosquitoes and the black flies. Almost last question. So my loved one's doctor talked to them about level of care. What does that mean? I want my loved one to be cared for. I think that's a really interesting point. So I'm sure some of you have had calls from your loved ones. I know at KMHC and Elders Lodge and ILC, as well as just general doctors, are talking a lot about level of care with their patients. And what does that mean? Level of care, or also known as level of intervention, is really about what would you want to do in a disastrous situation that your heart stopped. Now, it depends on your age and how well you are, as well as your beliefs. So I can't decide for you what is best for you. But it's really difficult to have that conversation when you're in the hospital or when things are really bad and that we need to decide if we need to intubate you or not. Because in the hospital, the first thing we're going to do is we're going to do everything. We're going to intubate you. We're going to do chest compressions, which may break ribs. We might intubate you and do chest compressions, and with that tiny percentage of being able to restart your heart, because it's not that high, we'd restart your heart and you might never be extubated. So we might never be able to remove the tube. So these are the things that are really important to talk about. And I have two friends, Geneviève Bois and Dr. Whitmar, both doctors. And on this Facebook Live, there's actually going to be a link to a video that they've produced. They did it in French initially, and it was so well received that they did it in English to talk about level of care so that you can actually discuss this with your loved ones. Often people only think about it very late in life, but I think it's something that you should discuss and be very open with your family what your wishes are, because everyone has different wishes and what they value, and some people value no matter what to keep them alive, and other people value their comfort and their that they making sure that they feel well and they're surrounded by loved ones. So everyone has a different opinion and what's important to them, and I can't judge that and you can't judge that for other people, but you can definitely judge it for yourself. So I encourage you to watch the video. If you haven't discussed it with your doctor, please do. My last point is about our orange neighbor to the south with the comb over. I've talked about it before. He's come out saying that we should take sanitizer and inject it into our blood or our lungs. Just in case everyone wasn't clear, this was a horrible idea. Horrible idea. No doctor has approved this, but sometimes people talk and you can't control what they're saying, just like the people in the room that I know I talk a lot. So this might be one of the last times I come on the Facebook Live. You don't know. I can't guarantee that it will be every week anymore. So with that, I want to say thank you very much and keep safe.
All right, thank you very much, Dr. Gauthier, and thanks to Tanner Phillips, Lloyd Phillips, and Lisa Westaway as well. And thank you for joining us today. Hopefully this was helpful, and hopefully you'll have a safe weekend. We'll see you tomorrow on behalf of all of us here. Nyawko Dano Onagiwahi.